How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melindy, and this is Disruptive Dialogue. Over the next 30 to 40 minutes, I guarantee that you will better understand how to choose your health insurance for 2026. When you should start looking, where to get the information, and understanding what you need for your insurance and at the lowest cost. Hey, Chet, welcome to the show, buddy.
Absolutely, Chuck. Really appreciate the opportunity to hopefully bring some value to you and your fellow disruptors on this webcast. Really looking for doing that, and based on my 4 decades of work in this industry.
I love it, man. Thank you so much. And look, I'm going to be honest here. I have to say that prior to retiring in January, I was with an employer for over 25 years. So I'm going to be kind of a newbie when we talk through this stuff because, I wasn't self-employed. I didn't have a gig job. I didn't work for a small employer that didn't provide coverage. And that's what we're going to talk about today. So I'm glad that I've got you on here and you're going to not just walk our audience through what to do, but me. So thanks so much, bro.
Absolutely.
So let's jump right into it, Chet. You have, first off, I got to give a shout out because my oldest daughter, when she turned 26, Chet had to help her get her insurance. And you did a great job. But what's the most common mistake that you think that people make when they're trying to choose insurance and they don't have that employer that's holding their hand? What's the biggest mistake that you see people making, and how can they avoid that?
I think there's a lot, Chuck, that goes into that question of yours. It's definitely loaded. I think the first thing that people need to do is to take their health insurance a little bit more seriously and put more thought into that process. Again, it's not like buying a pair of shoes or a shirt or whatever the case may be. This is something that for the most part, you're going to have and keep for the next 12 months for most all of us. We'll talk more about that later. There are times when you can make a change, but this is a decision you're going to keep intact for you and or your family for the next full year. So that'll be the first thing I would say. Second is making sure that you have a list of what's important to you and your family regarding this decision. Things like networks, doctors, medical facilities, prescription drug coverage, and things of that nature, so that we can answer all those questions and make sure we address them all, that you fully understand each and every one of those. So having the information and putting enough thought into it before you actually get into the process.
You know what? Thank you so much. I have to tell you, and I'm gonna take people off the hook to some degree. I truly think that health insurance, it's so huge and confusing. I mean, you go onto a website or you get something in the mail. I mean, people say, you know what? I got my EOB, and EOB is explanation of benefits, not a bill, as you know. But those things are like 8, 9, 10 pages long. I take care of my mom, and this is something I know. And all of that is so confusing and so much information. To be quite honest with you, I think it's by design. But I'm going to agree with you, Chet. I mean, I had a previous podcast and I said to people, look, if you're going to buy a car or buy a house or rent an apartment, you're not going to go there with no preparation. You're going to do some research. You're going to go online. You're going to talk to people. You're going to have your ducks in a row. You're going to know what you want. People don't do that a lot with health insurance, and I just don't get it. I mean,
yeah, back when you and I first spoke, I made a comment, and again, this has been proven to me over my career. It seems like some of my clients, and that's not the way they were today, but when I first met my client for the first time, it seemed like they spent more time preparing for a birthday party than they did their health coverage. You see what I'm saying there?
It's crazy because, dude, it's like $1,000 a month just for your premium. You would think people would take this seriously.
You would think. Yes, I agree.
It's nuts. So let's help everybody. We're not going to make fun of everybody because I'm sure there are things that we do not very well. But the goal of this summer series, Chet, was to help people make it simple. So what I want to help everybody understand is, look, every year there's a period of time that you can go and get your health insurance. It's called open enrollment, and it's usually in the back half of the year. Chet, could you share with everybody open enrollment, when that date is for, like we said, people under 65 that don't have employer insurance?
Absolutely. So the ACA has been out about 14, 15 years now. And for most all of those years, the enrollment period's been consistent. November 1st of each year until December 15th. There have been times when they've been extended for extenuating circumstances, but this year it should be, and it will be, 11/1 to 12/15 of this year, a 45-day window each year.
Awesome. And, just so everyone knows, when Chet says the ACA or the ACA Marketplace, some people may know that as Obamacare, and we're going to get into that a little bit, but you have 45 days to sign up. And so Chet, if I am a self-employed or a gig worker, or I don't get insurance through my employer, what are some things I should do prior to open enrollment, prior to November 1?
Well, again, it goes back to my original statement that people need to spend more time on this to start with. I'm not going to go into that again.
Yep.
That's the first thing I would do, is to put some thought and effort into the plan, develop a budget. How much can you afford to spend on a medical plan as part of your budget? I don't know if everyone budgets. I do. But I think that's a big deal to know exactly, or have a pretty good idea as to how much money you want to put out each month for your health care. Sometimes that's directly related to your health situation as well. And that will vary family to family. It's a situation, Chuck, where if I'm perfectly healthy, I don't really need to have a high-end medical plan per se. But if I'm contending with chronic ongoing medical conditions, I may have to be willing to put out a little bit more capital to getting the proper care I need at this stage of what's going on in my life.
Yeah, let's jump ahead. So, you bring up a great point, and everyone needs to realize healthcare is like anything else. If you need a lot of things, it's going to be more expensive. If you don't, it can be less expensive, and you have to make that choice. What's your priority? Is your priority that you get to go to a certain primary care physician, or you don't want to have to ask your primary care physician for referrals? You have to make those choices. So Chet, can you just at a high level, maybe share with people like HMO and PPO and how those things differ?
Yeah, sure. That's a common thing that I deal with on a day-to-day basis in my career. HMO, health maintenance organizations, were really developed by a company called the Kaiser Family Foundation out in California a few decades ago. And that is the most, let's call it, restrictive level of coverage in healthcare. You have a network, and you have to stay within that network, with the exception of urgent or emergency care. So if you don't have an urgent or emergency situation, the first thing you got to understand is I have to deal with this network of doctors and medical facilities, period, end of story, with that one exception. In a PPO, they're typically larger networks to start with, the in-network network, if you will. I know I'm being repetitive, but the network that they cover at a higher level is larger than an HMO on average, without a doubt. But you also can go out of network with coverage in a PPO, and you have none of that in an HMO.
And Chet, let me just jump in real quick because we're dealing with everybody out there, and they may not know what network means. Just so everyone knows, when Chet's saying a network, what he means is that insurance company has contracted with certain healthcare professionals, and they have a contract with a group of HCPs, healthcare professionals, and you have to use those. They're your in-network. If you go out of network, it's either going to cost a ton of money or you're going to pay for everything. So when he's saying network, he's saying this is who the insurance company is contracted with, and that goes for facilities, nurses, nursing homes, hospitals, et cetera. Okay, sorry, Chet.
No, that's a great point, Chuck. I definitely glad you clarified that for the audience.
Hey, I'm bringing it down to my level. Okay, you're the expert here.
The couple of other considerations between HMO and PPO is in an HMO, I said it's the most restrictive, not only also by the doctors, the network, the doctors that are in that, the size of it, the number that there are. Also, you have to get what's called a referral. Okay. And this is where if you need to see a specialist, cardiologist, urologist, pulmonologist, whatever the ologist is, your primary care doctor needs to put forth a notification, a formal notification called a referral for you to be covered through that HMO provider by the specialist you're going to. Okay. So if that it's kind of like saying to your primary saying, hey, I want to refer my patient to this particular cardiologist, and I just want to make sure you're aware of it. And they need to say, oh, okay, good to go. So
Yep.
they got to give you an okay on that in an HMO environment. In a PPO, not required. Period. End of story. Pick up the phone, call the specialist, go ahead and set the appointment.
Yeah, and Chet, the thing is, and I think a lot of people are going this way. Look, if you're a person that's pretty healthy and you don't go to a whole lot of specialists, you don't expect to go to specialists. If you don't really care who your primary care physician is, you're like, okay, I want to go get a physical and I may have to go see them if I have like a sinus infection or whatever, and don't really care, but you're worried about cost. HMO is a good way to go.
Just did an enrollment. Just did an enrollment yesterday for that exact reason. 38-year-old guy. He was going to get covered through his wife's employer plan. They were going to charge him over $700 a month to put him on as a dependent. I went into the ACA and got him a plan for a little over $400, and he went with an HMO because he's perfectly healthy, not on any meds, great height, weight, the whole 9 yards. He said, yep, I'll take the HMO to save a few hundred a month.
Absolutely. And I got a buddy 3 years ago, he yelled at me because he thinks I'm in healthcare. I know everything. And he's like, I never go to the doctor. I'm like, bro, call up a broker and get a cheaper plan. You don't need all this stuff. So you mentioned something, and I want to come back to this. So you mentioned the ACA Marketplace. So everyone out there, look, the ACA Marketplace or Obamacare, that's at healthcare, www.healthcare.gov. Even though that's a government-run site, those plans are run by private carriers. But you also have the private carriers, the Blues, Aetna, United, Cigna. Chet, give everybody like your perspective of those two different, the different places that they can get insurance and when it might be appropriate, when it might be better to do one or the other.
Okay, so we didn't talk about this, but over 90% of the enrollment in the marketplace, the Affordable Care Act, Obamacare, you're correct, Chuck, it all means the same thing. Over 90% of the enrollees are getting some level of tax credit, money that the federal government, based upon their income and demographic, is paying up front on their behalf directly to the insurance company and plan they chose through the marketplace. So over 90%. So that's what I will say first of all, is if you're going to be entitled to a federal tax credit, advanced premium tax credit, money from the government to help pay for your coverage, you have to go through the marketplace. The other reason to go through the marketplace, even if you're not entitled to a tax credit, is all 14 carriers in the state of Florida are there. Now, not all 14 practice in every county in the state, but again, all 14 are on the marketplace. There may be only 8 or 9 in your county that can offer plans based on the county you live. But if you want to see all the plans that are available to you, you can also go to the marketplace and look at the plan. So if you know the insurance company and you're not going to get a tax credit, you can also go direct. It's still a plan that is qualifying under the Affordable Care Act, under the Marketplace. But now you don't have a separate application with the Marketplace. The feds are not involved in your coverage. You're direct with the carrier, whether it's Blue Cross, whether it's United Healthcare, or any of the others that are available in your county. So you avoid an entire application. I hope I'm not confusing anybody, but at the end of the day, you can either go to the Marketplace to get money to help pay for your insurance if you fit in that segment where you're going to get money, or you can go directly to the carrier if you're not going to get money and avoid the Marketplace being involved in your health coverage totally.
Yeah. And so, Chet, everybody out there in podcast world, Chet handles Florida. And Chet, I know you used to go outside of Florida as well, but I think now you're just Florida. And I'm sure there's some podcast listeners outside the state of Florida. So, you can, to Chet's point, you can go to the ACA Marketplace and you can see what carriers are, participate in that. And Chet, correct me if I'm wrong, but you can fill out an application just to check out rates of the different carriers and not submit it and not have to deal with that and then go straight to a carrier. So you can kind of use it as like looking at all the plans on one place. Is that correct?
Absolutely correct. Yes. Unless you do an enrollment through the Marketplace, nothing goes through, if you will. You can simply look at the plans, see if you're entitled to a tax credit or not, and look at what's available in your county. And then if you're not entitled to a tax credit, there's a short way to do that as well. I don't want to get too much deep into the woods here, but
yep.
If you're with an agent that knows what they're doing, they can avoid all the financial aspects if you know your income is above the level of getting a tax credit. And you can simply go directly to looking at all the plans that are available as well.
Everyone needs to be aware that, we had a recent, the OBBA, or the Big Beautiful Bill, was passed. There have been some changes. You need to be aware of that because a lot of people on here may be going it through the Marketplace. By the way, if you did get tax credits last year, in the past, you would automatically be re-enrolled. That's not the case anymore. You have to prove what your income is. And then the other thing is, you need to look up federal poverty level, and don't take offense to that, everybody, but that's how they figure out if you qualify for these tax credit subsidies. And to be quite honest with you, if I qualified, I'd do it all day if I get a discount. So just look it up. It's easy. It'll do it by a family of 1, family of 2, 3, or 4. It has to be between 100% to 400% of the federal poverty level. You can put up on Google in 5 seconds. So do that research, look it up. That'll allow you to figure out, okay, do I want to enroll in the Marketplace, or do I just want to go there and check out the rates and then go straight to a carrier? Is that all correct?
All correct. A side note on that, one of the big changes that we're faced with right now, and I don't want to get too deep into it, but there's something called enhanced tax credits that are expiring at the end of this year. They were brought in about COVID time, 2021, right around in there. They were extended, and now they're ending at the end of the year. That essentially, the biggest change, there's other changes, but the biggest change that's taking place, potentially, if they don't do anything about this in Congress, is a lot of folks were getting way above the 400% mark. If you came in at 5 or 6 or even 7 times the federal poverty level, a family at 3 or 4 or 5 or 2, whatever it is, you would still be able to get federal tax money from the government to help pay for your insurance. So that is ending unless Congress does something about it. So I just wanted to bring that out. That's a critical aspect of a change that potentially may be taking place at the end of this year.
Absolutely. And Chet, thanks for the clarification, because I actually was confused on that. So everybody just know you hear all this stuff about this law that was passed. There were tax credit subsidies that were put in place back in 2010 or 2014. Those are still there. But during COVID, Biden did enhance tax credit subsidies. Those are ending at the end of this year unless Congress does something. So it doesn't mean that someone who's below 400% won't get tax credit subsidies. They still can, but you still need to read up on this. And Chet, now I'm going to throw you a softball, big guy.
Go ahead.
And this is something we talked about the other day, and I just wanted to make sure that, because I didn't really understand it. So should somebody go and get an agent, or do you think they can figure this out on their own? And if they do go get an agent, how much does it cost them to do that?
You know, that is a softball because it's so easy. Agents, I'll give you an analogy. A travel agent, if you use a travel agent to do professional traveling, you're not paying anymore. They're being paid by the cruise ship. They're being paid by the hotels or the whatever you're doing on that travel. The same thing is true with ACA. Whether you go through an agent or you go directly to the marketplace or directly to a carrier, the premium is the premium is the premium. I can't make that clear enough. So why in the world would someone go exclude professional health insurance advice or a health advisor to make sure you're making the correct decisions on such an important matter when literally and truly it isn't costing you a penny?
So I usually save this for the end, but I'm going to do the spoiler alert. If there's one thing that people take away from this podcast, go online and find an agent in your area that you can work with. It's free and you have an expert that helps you. The carriers pay them. You don't pay them. So like Chet said, your premium, which we covered on an earlier podcast, which is the monthly amount that you pay the insurers every month just to have insurance, that's not going to change whether you use a carrier or not. But I'll tell you right now, an agent or not, if you use an agent, you're going to make a better decision. He's going to ask you questions. He's going to help you customize what works best for you. Now, Chet, you're in the state of Florida. And I'm going to give people your information at the end of this call, and it'll be in my notes of the podcast. But say someone is out of state. How do they find an agent? What should they look for? Where should they go? Are there certain qualifications that they want to make sure that agent has?
I would analogize that, Chuck, and it's a very good question, to if you were going to have a procedure done with a doctor. If you were going to have something done medically, I would probably do some research on that doctor or his agency or both, perhaps, to make sure that this guy knows what he's doing if he's cutting into me or doing something else that's going to affect my life potentially for the rest of it. Same holds true with health insurance, in my opinion. I would make sure, get information, I would go Google a local specifically health insurance agency and call them up, get background information on the agency, and then find out who their most experienced agents are that are within that agency, and get some additional information from them. And they can expect that. If I get a referral, I let people know what I do and how I did and how I am in doing this, how I conduct my practice. I think that's fair. I think agents that are pros in this business should expect, just like doctors would, to be questioned with something this important.
I love it. That's awesome. So, so let's get back into a little bit of the nitty gritty. So, everybody hears about prescription drugs and how high they're going and all this kind of stuff. As far as prescription drugs go, how do people figure out what's covered, what's not covered, anything that they should be weary of for next year, for 2026?
Yeah. When it comes to medication coverage, that's something that goes with that being prepared. If you're on medications, I would, as my client, I'd want to know the name of the med and the dosage amount of that med. So I can look it up on what's called the plan's formulary. Every plan that is put onto the ACA with all carriers, doesn't matter, has a formulary attached. Those are the medications that will be covered under the plan once coverage begins. In addition to that, the agent that's what the agent does. Again, that is not really a layperson doing that. That's someone who does that day to day for a lot of years. They can look up the, how it's going to be covered, the tier of that medication. Meds come in, 5 or 6 different tiers, tier 1, 2, 3, 4, 5. The higher the tier, the more expensive that medication. So again, and they can tell you exactly how much you should be paying. The same for your medical care under the plan. My clients know exactly how much they should be paying for their meds or their medical services. That's important.
Yeah, I love it. I mean, so you get a hold of an agent and you're like, here's my budget. Either you care or you don't care who your primary care physician is. Either you care or you don't care that you have to get a referral to a specialist. These are the medications I take. This is the dosage that I take it for. And let's figure out what's my monthly premium, what's my deductible, what's my copay or coinsurance for those meds. I mean, those are things that could make a huge difference for people.
Absolutely. No doubt about it, Chuck. A couple of quick other things. Again, I don't want to go too long here, but I think they're important.
Oh, you're fine.
One of the common questions I get is, well, what if I have, a medical condition? Understand that the main reason the ACA came out when it did, based on my decades in this business, I think the main reason it came out was because the health insurance industry, back when I was involved in underwriting, either excluded the medical condition that somebody wanted to get covered for individual health, or they declined them totally for coverage, sent them a decline letter. They were common back in the day. And I think that was the main reason the ACA came about. That no longer applies. For anybody that has existing medical health issues, there are no medical questions on these apps, with the exception of one, and that is smoker or non-smoker. And again, it's not that you're going to be declined. It's just that the rates for a smoker are going to be higher than that of a non-smoker. That's the only medical situation that's allowed to be asked health-wise on an application.
Yeah, Chet, I mean, just thank you, because I don't think a lot of people realize when the ACA came out, or Obamacare, that it wasn't just about getting uninsured people insured and trying to lower costs, because the costs have gone up dramatically. But to your point, insurance companies were disqualifying people who had existing conditions. They weren't able to get coverage. And so that is something that the government did that I think was awesome.
Absolutely.
The other thing, and maybe you can expand on this, is essential health benefits. Small group or individuals, am I correct in that the essential health benefits that are covered under premiums in the ACA Marketplace also will pertain to people who are just individuals, gig workers, going straight to a carrier?
Absolutely. There's 10, I don't want to get into all 10, but there's 10 specific areas of essential health requirements, benefits, as you call them, that have to be in every plan that's admitted to the Affordable Care Act in all 50 states across the nation. And that was to me, that was the big reason. I mean, things I just mentioned, pre-existing condition clause was one of them. Another common exclusion was pregnancy. You have a major medical plan that you take and you put in place, and they don't cover anything for that pregnant woman that's involved in the family. So all these things, along with 8 others, are covered in all plans, no matter what carrier you go, no matter what company you choose. Those 10 essential minimums have to be present in all plans. One last thing before I forget about it. If you miss the enrollment period, you're typically out for a full year, for the remainder of the year. During the enrollment period, your coverage starts January 1 of the upcoming year. So you enroll in either November or first half of December. Coverage starts January 1 of 26. There are exceptions to that during the year. Believe it or not, there's about 15 exceptions. Things that have to do with if you lost coverage through a job, you lost qualifying coverage elsewhere through a children's insurance program, you get married, you have a child, you adopt a child, you're moving from one county or state to another, loss of dependent status, 26, you can't stay on your parents' plan anymore. So there's a bunch of special election periods that during the year you can enroll in. But if you don't have one of those, what they call life-changing events, you you are locked out from getting coverage again until the end of the year.
And once again, if you have a brain fart and you do not sign up by December 15th, reach out to an agent. I guarantee you, your best chance of figuring out a way to get enrolled in health insurance is with the help of an agent.
Absolutely. Absolutely. So a knowledgeable, experienced agent is someone you want working with you. And also, if you have an experienced agent, say at least 5 years anyway in practice, that's telling you something that he's taking care of his clients. Most of the, let's just say, not so straight folks that come into our industry are gone within 5 years if they don't have the client's best interest at heart. It's not just the sale, it's the service after, as they say, as I say. I'm always here for my clients. I get calls every single day about what I should be paying, what should I do in this situation. You know, you want to have someone you can rely on to give you the proper advice when it comes to health decision-making issues in your family during the year and every year thereafter.
Yeah, that's awesome. And so there's another question when you're screening your agents is how long you've been doing this, and you look for that 5-year mark. So Chet, one thing that I looked at, because I touched on this a little bit in a previous episode, was in the ACA Marketplace, and I looked at the services that were covered 100% after you pay your premium. So you're not going to pay a copay, coinsurance, although it won't hit your deductible. Now, I saw it broken down by children, by adults, and by women. Does that translate from the marketplace to, individuals going straight to a carrier?
No, it doesn't matter. No, it doesn't matter. The only medical coverage under now this is different with Medicare, but the only coverage that translates to fully guaranteed 100% coverage under an ACA plan, a marketplace plan, an Obama plan is going to be your annual physical exam. It doesn't matter what you did. And for women, it's the female exam as well. So again, it doesn't matter, what plan you're under, what the deductible is. Now, there could be other 100% coverages in a plan, depending on the plan you select. Not to confuse that issue, but the only one that's guaranteed by the federal government to not cost you anything is either your wellness exam or a well-woman exam, if you will.
Cool. Thank you.
You're welcome.
So let's start to get a little more granular. So like say if someone says, and we touched on this briefly, what if I have a chronic condition, diabetes, arthritis, or asthma? Is there anything specific they should look for in that plan detail? Like, who their specialist is and are they in network? Any like pearls that you would say?
That goes back to your preparation. If you're dealing with those chronic medical conditions you just mentioned, I give you tremendous odds that you've already have relationships with specialists and a primary care doctor as well, or you should anyway. So we want to make sure that those doctors are in, again, back to the network, whether it's HMO or PPO, that the doctors are in that network. So you're paying as little as possible when you go visit those medical professionals. The same goes for the prescriptions to treat those conditions. You want to make sure that the diabetics or whatever you're taking for a medical condition is in the formulary. That's what the list of meds are called, the formulary that the carrier puts out to cover drugs in that particular plan. Again, this goes back to where I said earlier. You really should be working with an agent that has the ability and the knowledge to go through all of this and make doubly sure that, especially with pre-existing medical conditions like that the plan's going to cover it and cover it to the exact level you're going to get that coverage for.
Awesome. Thanks for the clarification. So a couple other like weird questions, but hey, this probably impacts people and they may be curious. Say during the year, your income changes. You get a new job and you get a big bump in pay, or you get a huge raise during the year. Does that affect someone's premium, their coverage, any subsidies they're getting?
Absolutely, it does. Again, the way the marketplace income works is you have to estimate in the open enrollment period. Great question, Chuck. You have to estimate for the upcoming year. It doesn't matter what you made in 24. I'm sorry, in 25. If we're looking at next year's plan in 26, God, I'm getting old. Um, but if we're looking at next year, and I'll be having this exact discussion with each and every client here in the next month to 2 months. How close can you get me? Get me close to what you think. Now, for people that are salaried or hourly, it's not that difficult to do. They might have some overtime, not a big deal. To people that are self-employed, however, that
Yeah.
can vary dramatically depending on how the year goes. So if you have a significant, all my clients know this, if you have a significant income change, please, if either you do it or if you're working with an agent, and I hope you are, uh, call your agent and they can go in on your behalf and adjust that income. Because if you don't do that, and you make an extra 15 or 18 or 20 grand on the year, well, you're going to owe some money back to the federal government because they don't know that till you file your taxes. So when you file your taxes, you get a 1095-R that says, this is how much you paid. This is what you were entitled to. But we overpaid you because you told us you were going to make, 40 grand when you did 63,000. You see what I'm saying?
Absolutely. No, that's great. Another reason go talk to an agent. So now I'm going to talk. I'm going to give it away. This is my age group. But what if people say between the age of 60 to 64 they're nearing Medicare? Should they be anything they should be looking out for when they're choosing a plan with just a couple years till they hit Medicare? Or does it not really matter?
It doesn't really matter. I don't think it matters. Each year, you're going to be speaking with your agent advisor, if you have one, and we're going to reassess. That's what I do. The health status. I don't have to know all the details on your health, but has there been any major health changes so that we have to change the plan for the upcoming year? Once we get into Medicare, that's a totally different animal. Once we're going into Medicare, a lot of things change at that point. But for the good, by the way, I might add. So don't fear Medicare, Chuck. I've been on it for over 5 years now. It's a great position to be in.
Awesome. I love it. I'm looking forward to it.
I wouldn't change a thing. Just consult once a year with your advisor. Make sure that the same plan you were in for those years before you get to Medicare is still going to meet your needs. If something new's come up, then that's the time to address it and to make a change, whether it be the network because you lost a doctor and you want to keep that doctor in network, or whether it be the plan because I came down with this significant, or I'm going to have a major surgery, God forbid, and I want to go to, it's going to be elective surgery, but still medically necessary. But I'm going to have it. Well, then I might want to go to a higher level plan as well, even though it's costing me more. I can drop that deductible and maximum out of pocket under the plan significantly for that medical procedure. Make sense?
Oh, absolutely. And one thing, and you can validate this and maybe expand on it, but what I really don't want people to do is like you go to an agent, you get a great plan, it fits your budget, your lifestyle, everything. And then next year rolls around, the end of this year, and you're like, you know what? Nothing's changed. I'm going to stick with that. Chet, tell me if I'm wrong, but that's a huge freaking mistake because plans change their networks and their formularies all the time. You cannot assume it's going to be the same. Am I right?
Absolutely correct, Chuck. That's why I talk to every client, every open enrollment period. I make it a point. I'm on the phone a lot. So that way I can address the changes not only to potential formulary and networks, which do take place for sure. Also, I got news for you. The plans change every year. Deductible changes, out-of-pocket max changes, the amount of the copay may change as well inside that plan. Copays are the medical services within a plan that you only pay that flat stated amount, whatever that dollar amount is, outside of any deductible. So if I have a copay of, say, for a primary of $40, that's all I pay to see a primary, even though the deductible might be $6,000 or $7,000. So again, those change as well. So because of all these changes, network, formulary, plan changes, you definitely want to re-examine your health insurance for the upcoming year for sure. Absolutely.
Awesome. Only a couple more questions and then I'm going to let you go. Everybody, just so you know, Chet and I are working hard. It's 5:35 on a Friday, Chet. We need a beer. So say someone's got their plan, they're feeling good. Are there any strategies throughout the year that people should be considering, or once you got your plan, just stay healthy and I don't know. I'm asking you because I'm not positive.
I don't. There's no strategies during the year, and even if something you wanted to change, you can't change it, Chuck. So
Right.
no, the plan is the plan is the plan for the upcoming year. That's why it's so critical that you make the correct, informed decision on the plan and the network you're utilizing to get your medical care. So really, there's no strategy. Uh, the only strategy I would say is if you're not working with an agent, when you're looking at a plan, uh, even entry level plans in Florida. Again, I'm not speaking for other states, but in Florida, entry level plans, at least with the carrier I represent, that has the largest enrollment in the state by far, about 1/3 of the enrollment, which is Florida Blue, and their entry level plans, you could have no deductible on entry level plans for things like primary care, specialist, urgent care, and lab work, along with your annual exam, as I said, is mandatorily covered. So you've got the most common areas of medical care with no deductible, either fully covered or with a flat stated, reasonable copay. And for an entry level plan, that's a strategy I think everyone should be aware of and employ for sure in their medical coverage, because you're likely going to be using one or more of those areas of coverage.
Awesome. Now I am going to throw you one that you may not have thought of, but because to you it's probably like, well, that's obvious, but maybe you can expand on it. So let's talk deductible. Someone has a deductible. Say it's $2,000 and it's September or October and you had a lot of stuff and you're at like 1,900. You're close to hitting your deductible. I've always been like, I'm going to try to squeeze in stuff for the back half of the year before the new year starts, because I'm about to hit my deductible where the insurance is going to start paying for quite a bit of my services or my meds or whatever. What are your thoughts on that, and what should people think about?
Totally agree with the strategy. Yeah. If you're that close and it's a 2,000 deductible, definitely get whatever you need done so the insurance company is paying the lion's share of it. Having said that, remember there's a big difference between a deductible and a max out of pocket. So if you have a deductible, using your example, Chuck, of $2,000, after you hit that deductible, you're in that type of plan. I'm being realistic here in terms of what I'm bringing to the table. Your out
Sure.
of pocket in that example would probably be around $4,000. If you have a
Right.
deductible, you'll have around a $4,000 max out of pocket. So what does that mean? That's a common question I get.
Yep.
So you hit your deductible of $2,000. After that, you have what's called cost sharing. The industry defines that as co-insurance. And you're paying a percentage, you're sharing the cost along with the insurance company. The co-insurance percentage, the typical ones are 50%, 70%, and 80%. So after you hit that 2,000 deductible, if you had a 70% co-insurance, the insurance company then is paying 70% of the medical care at that point for you. You're still paying 30% until your 30% hits $4,000. Now, the $4,000 with all the major providers includes the deductible. So you've already put out the 2,000 deductible. You're paying 30% after that. So when you put out another $2,000, you've now hit the maximum out of pocket under the medical plan. And everything then, no matter what you have done, is covered at 100% when you hit the max out of pocket.
So you said the medical plan, Chet. So would that include drugs?
Interesting question, Chuck. And before ACA was enacted, drugs were on a separate platform. When ACA hit, yes, drugs are now included in the max out of pocket in the plan per federal regulation. Correct.
I love it. So bringing this back home, And Chet, this is great because you're reinforcing and expanding on some things I said because we're in our summer series of Healthcare 101 is your premium, everybody, as you remember, that's what you pay every month, whether you do anything or not. And there are some services that will be 100% covered. So always look and see, because if you're paying a monthly, you might as well use whatever they're going to do, like a checkup and physical and stuff like that. The deductible is what you pay. That's 100% out of your pocket, and the insurance company does not contribute till you hit your deductible. So in Chet's example, if I've got a $2,000 deductible, I'm paying my monthly premium, and then I'm spending up to $2,000 all out of my pocket before the insurance company kicks in. At $2,000, once I hit that, I met my deductible. As Chet said, now the insurer starts to pay 50% or more of the cost when you hit your out-of-pocket max. And so in Chet's example, that's $4,000. Number one, that does not include your premiums. That includes your deductible and then all your co-insurance, copay, etc. But once you hit that out-of-pocket max, insurers pay 100% of everything. If you do that before the end of the year, whatever you've been putting off, do it. Because once 1/1 hits, you start back at zero again. Is that all correct, Chet?
All correct. And you brought up something I didn't touch on, Chuck, and that is the copays in a plan. Many have 5 or 6 different copays. That does not go towards your deductible with any carrier. It does go to the max out of pocket, however, as you stated, Chuck, so correctly. So again, if I had a few $100 of copays and then I'm hospitalized and have a major hospital stay, my copays come off that $4,000 in the example we used, so that after you hit the deductible, instead of having a $4,000 max out of pocket, it may only be $3,500. You see what I'm saying?
Yep.
So,
awesome.
Great thing. I forgot to bring that up. And then I just wanted to bring the couple of last things up here real quick. Great stuff, Chuck. For your audience, I believe. I know if I was a lay person looking at this, not knowing anything, this is, I think, going to bring me, light years ahead of where I perhaps was. And that is the special election periods only last for 60 days. I want to just make that point. It's not forever. So if you miss the enrollment and you're eligible for one of these special election enrollment periods during the year, it's only 60 days. I speak to a lot of people that wait too long when they lost coverage and they didn't act in a timely fashion. And the second thing is there's another benefit, a secondary benefit called, and with the marketplace, called a cost share reduction, a CSR. And if your income, either as an individual or a family, is within 2.5 times federal poverty level, okay, not only do you get the advanced premium credit, that money from the feds that they're putting up front towards your health insurance, and that's going to be a big amount if you're within only 2.5 times, you get a secondary benefit where the federal government, through the plan you selected in the carrier, buys down your deductible to near zero. So you have almost either, depending on the income level, whether it's 100%, 150, 200, 250, there's 3 levels. But trust me, they're going to buy down that deductible in the plan to, to a fraction, let's just call it, of what the standard would be. The same with the out-of-pocket and the same with co-payments. So the plan benefits are enhanced dramatically if you're within 2.5 times federal poverty level. But you do have to go on a certain level of coverage with the marketplace to get those benefits. It's a silver level plan. And again, without getting into the weeds, that's where your agent would come back into helping you make the right choice.
Great extra things that I didn't know about. So just to clarify, as we said at the very beginning, open enrollment for all the individuals wanting to get health insurance for 2026 that are not getting employer-sponsored insurance. Your enrollment is November 1 to December 15. If you do not enroll by December 15, you can enroll if you have a life event or a special event, and people will have to look that up or talk to your agent. But Chet, I didn't know this. You only have 60 days. So between December 15 and February 15 to do that. And if you don't, you're SOL. Is that correct?
Would you say 60 days? Yes. If you're talking about the SCP, Chuck?
Yes, sir.
Okay. So when you lose coverage, your last day of coverage with your, let's say, use the example of
is going to lose at 12/31. So you go 1/1. Okay.
Yeah. So it's 60 days. If I lost coverage on December 31st, okay, I would have to get another plan in play within 60 days of that point. So by February, well, actually it's 60 days. So it would take you into March because there's only 28 days in February. But I'm just saying you have 60 days from the last date of coverage to pick up another plan through the Affordable Care Act, through the marketplace. If you go beyond 60 days, you're done. You can't get in another plan until the end of the year for open enrollment of the next year. That's very important.
Yeah. So look, everybody, just enroll between November 1 and December 15, because if you don't, your coverage for this year ends on 12/31, and then you only have 60 days. And that's only if you hit one of those special exceptions.
Correct.
So you're going to have to go get married or have a kid or something to get insurance, or go climb in a shell and don't get hit by a car or something. I don't know. So Chet, anything else you would like to leave with everybody before we wrap this up?
Well, I'll just, again, at this stage of my career, I generally only take on new clients through referrals, because again, I have a large book of business, but being that you and I, Chuck, have a relationship through this podcast, and again, if you just want to call me, I'm all about value. So if you just one of your folks want to give me a call because they have questions, they want something, further explained, even if they're out of state. I even review plans, Chuck. People send me plans and say, look, Chet, I'm no longer in Florida. These are the plans available. This is one that they want to charge me for it. Does it make sense? And I'll give my opinion on that, why I would choose one of the three plans and why I would choose it. So if anybody has needs any guidance or wants help through the marketplace for sure, or just has any other questions, you're more than welcome to give me a call.
Chet, that is more than generous. I will include your cell phone in our call notes. So if people want to reach out to you, they can. And I truly want to thank you for sharing your insights today. I mean, look, we can walk through this 100 times. It's still a daunting task. I think the takeaway is to make sure you get an agent, but at least people should know when they need to start to enroll for a plan, who they should talk to, how they should prepare ahead of time. And, I just think you have really added some comfort. Heck, even I learned a bunch of things today, which I think is great. I know you only handle Florida. I think you already gave everybody a good idea. Use that 5-year experience, check on recommendations and everything if you are out of the state of Florida. What else do I have? Oh, I got one. And Chet, you already agreed to this, so I'll announce it. I hope everybody enjoyed Chet today because he's going to work with me on the next episode, which is going to be on Medicare. So all the old farts like me that are either 65 or almost 65, we're going to walk through that. So that being said, I just want to thank everybody for joining us today on Disruptive Dialogue. If you enjoyed the episode, please subscribe, share it with a friend, leave us a review. Until next time, stay informed and take charge of your health. Take care, everybody.